Welcome to 26-7. Here we'll just finish out the chapter for the urinary system. Here we're going to talk about urine transport and micturition. So urine transport in males, on the left we have sagittal view, anterior on the left, posterior on the right. And the picture on the right is showing you the ureters and the major and minor calyxes in the kidneys and how that's all congregating down to the urinary bladder. On the left, I want us to focus on the urethra for the males. So we have the urinary bladder in the center there, and we have the ureters coming in. And remember, we talked about the trigone. So the left ureter is at one of the triangles of the trigone, and then at the posterior inferior, the inferior portion of the urinary bladder. So we don't have to oppose gravity. We're going to have the entrance of the urethra. So then the urethra extends down, goes through the erectile tissue of the penis, which we'll talk about in chapter 27, with a little bit of 28. And then the urethra finally extends out outside the pelvic cavity and externally, hopefully, into a toilet. I want you to pay attention here compared to the females. The urethra is a lot longer in males than it is in the females because it has to extend through the outer portion of the pelvis, versus in females, we don't have to come anywhere outside of the pelvis. We're all inside. And then for the females, the urinary bladder is positioned almost identically to the males. Here in the males, we don't have it cut open, but here in the females, we do. The urinary bladder is also a muscle. It's going to be anterior to the uterus, which we'll talk about in the reproductive chapters. So it's still anterior for both. It's still positioned the same places for both. We just have one other organ internally for females. On the right-hand side, we have a nice picture of the ureters coming in to meet the urinary bladder, and then the trigone, or at the trigone, and then the last part of the triangle is where the urethra comes out. For males, the urethra has to pass through the prostate. So if a male has prostatic cancer, that can actually constrict the urethra and prevent urine from coming out, which can be really problematic and put a lot of stress on the bladder. So the good thing about prostate cancer is that usually the prostate has its own separate set of membranes that isolates it from everything else. So cancer in the prostate usually doesn't travel to other organs. So it's usually really easy to surgically remove. But one of the first symptoms of prostate cancer that has, I don't know if it's second or third stage or whatever, but it's progressed to ways, is pain during urination, or like poor urination. You feel like you don't fully relieve yourself. You don't fully get rid of everything that's in the bladder. What else do we need to mention here? I don't believe anything else. The walls of the ureter. The ureter actually is going to have a muscular layer. So we have a mucosal layer in order to prevent any abrasion of the epithelium. We'll have a muscular layer so it can actually contract and help pulse and push fluids down, just like peristalsis, or similar to peristalsis in the digestive tract. We'll have an outer connective tissue to help hold it in place. The ureter's already able to contract. The urinary bladder, hollow muscular organ with rugae, so rugae just like the folds we saw in the stomach. We have a layer of peritoneum covering it, so it's retroperitoneal. The medial umbilical ligament is stabilizing it anteriorly, as you saw in complete anatomy previously. We have two lateral umbilical ligaments. That's strapping it in laterally to the pelvis. And then we have the trigone, which we've mentioned many times. The urethral opening is surrounded by the neck of the urinary bladder. So the neck is really important because within the neck we'll have two different sphincters, which we'll talk about for micturition. And this is where our nervous supply is going to come in and out from, which will make more sense whenever we talk about the reflexes. The urinary bladder itself is going to have a mucosa, submucosa, and muscular layer. Nothing different about the mucosa and submucosa like we've talked about previously, but the muscular layer has a specific name. It's called a detrusor muscle. So this is really specific. So whenever for the lab practical, if it's the urinary bladder and we're asking you for, identify this tissue, say detrusor muscle, not urinary bladder muscle, detrusor muscle. We have two layers the detrusor muscle has 3 different layers, one internal, one external, that are in longitudinal bands, and then perpendicular to that we'll have a circular layer of band of tissue, which means it's a pretty solid muscle. It is almost as strong as the stomach. It has just as much of muscle, probably not as thick as the stomach whenever you look under a slide, but still quite a bit of muscle to it. So control of urination. So we have the urine storage reflex and we have the urine voiding reflex. We'll talk about these both, but the next slide does a pretty good job of actually showing you images of it. I'm going to zoom in here. So urine storage reflex. So this is where the bladder is the kidneys are continuously making urine. Urine is going down into the ureters and being stored into the urinary bladder. So how does the urinary bladder know that right now we're storing it and we're not ready to actually urinate, right? We need to have a way to continue to plug the inferior end of the bladder so that no leakage is happening. So in order to do that, we're going to activate some spinal reflexes. So reflex means no subconscious. It's all through the spinal cord, in and out. I don't know if it's a monosynaptic or like a regular reflex where you've got the 3 neurons or the two synapses. I'm not sure, but whatever, spinal reflexes. That's part 1. Part 2 is we need to be able to tell the brain, hey, I'm making urine. We're storing it, and at some point we've got to release it, just letting you know, just a heads up. So we're going to do that in the pons, in the brainstem, in the pontine storage center. All right, so how does this happen? So urine is coming into the bladder starts stretching. The stretch receptors get activated. Those stretch receptors are going to go back to the spinal cord and tell the spinal cord, hey, we need to hold on to this. So we're going to turn on sympathetics to the detrusor muscle and the internal urethral sphincter. So it's internal because it's the first one. External is the one that actually lets us micturate or urinate. So those outflows go to the urinary bladder and the internal urethral sphincter, and they tighten. They hold on to the urine. Parasympathetics are decreased. That'll make a little bit more sense once we finally get to the voiding reflex. Motor nerve activity is increased at the external urethral sphincter, so that we can use it if we wanted to urinate at that time. Right? Like, we don't have to urinate whenever the bladder is 100% full. We can urinate if it's 50% or 25%. So it lets the external urethral sphincter know, like, hey, if you want to relax, you can. Go ahead. Then the voiding reflex. So this is actually getting rid of the urine. Again, spinal reflexes and pontine center are going to be involved. We store the urine. We activate the stretch receptors. The pontine center gets told, hey, we want to let go of the urine. It's time to let go of the urine. So the spinal reflexes increase parasympathetics so that things relax. Sympathetics decrease, so things relax. And decrease efferents. So efferents, remember, motor activity out to the external urethral sphincter, so the external urethral sphincter relaxes. Then detrusor muscle contracts, sphincters relax, urine comes out. So here's a picture. On the left is storage, on the right is voiding. So let's go with storage first. At the top we have the pons. In the middle we have like thoracic region. At the bottom we have the sacral region. And then we have the bladder and the internal and external urethral sphincters. So let's start urine storage reflex. Let's start with the red. So stretch receptors in the bladder get activated. Those afferents go into the ventral horn of the sacral spinal cord. Oh my God, ventral horn. Why is 201 coming back up? Again, you need to know all of this for the cumulative final. So afferents go in. Goes through the to the thoracic region. Why the thoracic region? Because that's where we've got autonomics coming in and out. So parasympathetics and sympathetics. So those go activate the internal urethral sphincter and tell it to contract so it can hold on to the urine. At the same time, we have another branch crossing over and going up to the pons, telling the pons, hey, we were making urine, everything's going well, we're storing it. At the same time, the pons come down and tell the external urethral sphincter, hey, you should hold on to the urine, but you're activated in case you want to micturate at any time. Okay, now we go to the voiding reflex. So again, we start with the red. So the detrusor muscle It gets the stretch receptors, those get activated, those go up and to the pontine center, tell the pontine center, hey, there's a lot going on over here. We really need to let go of the urine. So the pontine center comes down, goes to the autonomics of the thoracic region, says, hey, internal sphincter, like, you're good. We don't need any sympathetics going to you. Parasympathetics can be the... Remember, parasympathetics and sympathetics are always activated. They're just balancing each other out. So parasympathetics are going to be slightly more on than sympathetics. So the internal urethral sphincter relaxes. Then we're going to send another motor neuron out to the... I shouldn't say motor neuron. Efferent motor neuron out to the external urethral sphincter. That also relaxes, and so that urine can just flow through. If that made zero sense, please rewind the video, follow it step by step. You guys know this stuff. Don't let the big fancy words confuse you. Just remember what parasympathetics and sympathetics do. Remember where autonomics come in and out from. Remember your reflexes, where afferent in, interneurons maybe, and then efferents out. Afferents are usually sensory, efferents are usually motor. And this will make a lot of sense. Just find a way for it to make sense to you, and I'm happy to explain it in a different way if you need. Age-related changes. Never age. It's terrible. Here's a fancy word for kidney stones. Nephrolithiasis. I have no idea. Decrease in the number of functional nephrons. So eventually, over time, your nephrons they just become fibrous, and then you can't have filtrate passing through them anymore. Which means you're producing less urine overall, which means you're not absorbing as many of the nutrients or reabsorbing as many of the ions and nutrients as overall. You have a reduction in GFR. So the glomerulus is not as good at filtering out as it used to be. Eventually you get through to renal failure, potentially, or you could, get renal failure for other organs that are dying off. Renal failure can be another. I shouldn't say opportunistic, but it's definitely one of the organs that is prone to failing if other organs are also failing. A reduced sensitivity to ADH. So over time, ADH is not as good as doing its job as it used to, which you might think might be a good thing because we don't want to increase blood pressure all of the time. But ADH, remember, is also helping us to dilute the sodium that comes into the bloodstream. So we do want ADH, we just don't want it to be an overdrive all the time. And then problems with urinary reflexes. You'll have a harder time being able to control the internal and external urethral sphincters. So you might have external, or you might have urine leakage that's unintentional and might even be unconscious because you don't have any conscious control of those muscles anymore. As with all of our chapters, we always have a homeostasis piece. This is towards the end of your book. The kidneys are really, really important. They're filtering out blood. They're holding on to a bunch of nutrients that we need. So homeostasis is massive for the kidney. We've talked about lots of different hormones that intertwine with other systems. So it's really, really important to understand what's going on with the kidneys and be familiar with the RAS system. We've talked about the RAS system many times. So please be familiar with that too for chapter 26.